Like most of the other areas of science, physics is foundational to different aspects of modern medical sciences. Every heartbeat, every breath, every movement of a limb obeys the laws of physics. Before medicine can diagnose, treat, or heal, it must first understand forces, motion, energy, and flow. Physics is not separate from medicine. It is the invisible framework that makes medical science possible. In this first part, we explore how core areas of physics, mechanics, fluid dynamics, waves, and thermodynamics, form the foundation of modern healthcare. First, we consider mechanics, particularly forces, motion, and the human body. Mechanics is the branch of physics that studies forces and motion. In medicine, mechanics becomes biomechanics, the study of how forces act within the human body. At its simplest, mechanics explains how bones act as levers, joints act as pivots, and muscles generate force. When a person lifts a cup, their biceps contract, pulling on the forearm. The elbow joint acts as a fulcrum. This is classical lever physics in action. Understanding forces is crucial in orthopedics. For example, when evaluating a fractured femur, clinicians must consider weight-bearing forces. The distribution of force determines whether a fracture remains stable or requires surgical fixation. Mechanics also explains injury. A sudden acceleration or deceleration, such as in a car accident, creates forces that can damage tissues. The severity of trauma depends not only on mass, but on how rapidly velocity changes. This is why protective equipment, such as helmets, works. It reduces the rate of deceleration, lowering force transmission to the brain. Even posture and rehabilitation rely on mechanical principles. Analyzing torque, balance, and center of gravity allows physiotherapists to correct gait abnormalities and reduce strain on joints. In short, mechanics allows clinicians to understand how and why the body moves, and how it fails under stress. In lever terms, the biceps acts with a short moment arm, trading mechanical advantage for speed and range. Estimating joint reaction forces requires considering both external loads and muscle forces, which can exceed several times body weight during everyday tasks. Ground reaction forces during gait typically show a biphasic pattern. Peak magnitudes relate to cadence and footwear cushioning, informing rehabilitation progressions and return to sport criteria. Fracture stability depends on mode of loading. Compression favors callus formation while shear and torsion delay healing. Fixation choices balance stiffness to prevent motion with micromotion needed for secondary bone healing. Helmets increase impact duration, reducing peak force via impulse momentum principles. Energy-absorbing foams and the helmet's multi-directional impact protection system, MIPS, help to redirect rotational acceleration, a key risk in concussive injury. Reducing moment arms, bringing loads closer to the body, lowers required muscular torque and spinal compression. Neutral spine alignment optimizes load sharing across discs and facets. Postural stability indexes, sway velocity, and single-leg stance time quantify balance. Training improves proprioceptive feedback and reduces fall risk in older adults and post-operative patients. If mechanics explain structure and movement, the next question is, how do fluids behave inside the body? Another important aspect of physics in medical sciences is fluid dynamics. Fluid dynamics studies how liquids and gases move. In medicine, its most vital application is the circulatory system. Blood is a fluid driven by pressure differences generated by the heart. It flows from regions of higher pressure to lower pressure. The relationship between pressure, flow, and resistance is fundamental to cardiovascular physiology. When blood vessels narrow, resistance increases. Even a small decrease in vessel radius dramatically increases resistance to flow. This is why conditions such as atherosclerosis significantly affect blood pressure and cardiac workload. Understanding fluid dynamics helps clinicians interpret blood pressure readings, manage shock, and evaluate heart failure. It also explains why intravenous fluids must be administered at controlled rates, and why catheter diameter affects infusion speed. Beyond blood, Airflow in the lungs also follows fluid principles. Air moves along pressure gradients during inhalation and exhalation. In asthma, airway narrowing increases resistance, making breathing more difficult. Thus, fluid dynamics provides the language to describe circulation, respiration, and life-sustaining flow. Laminar flow dominates in small vessels, while high Reynolds numbers in the aorta and stenoses promote turbulence, increasing energy loss and murmur intensity on auscultation. Arterial compliance dampens pulse pressure. With aging and hypertension, reduced compliance elevates systolic pressure and afterload, stressing the left ventricle. Blood is non-Newtonian. Viscosity falls with increasing shear rate. Elevated hematocrit raises viscosity, impairing microcirculatory flow and oxygen delivery. Capillary filtration depends on Starling forces, balance of hydrostatic and oncotic pressures, clarifying edema in heart failure, nephrotic syndrome, and cirrhosis. For catheters, flow scales with radius to the fourth power and inversely with length. Short, large bore lines deliver rapid resuscitation when seconds matter. Airway resistance and lung compliance shape pressure-volume loops. In asthma, bronchodilators reduce resistance, improving expiratory flow and reducing air trapping. Transition, movement, and flow are essential, but medicine also relies on waves, particularly sound waves, to see inside the body. Let us now consider waves and its applications in medical sciences. A wave is a disturbance that transfers energy without permanently moving matter. Sound waves travel through tissues as mechanical vibrations. Ultrasound imaging uses high-frequency sound waves transmitted into the body. When these waves encounter boundaries between tissues, such as between fluid and muscle, some of the sound reflects back. The returning echoes are detected and converted into images. The clarity of an ultrasound image depends on wave properties, such as frequency and wavelength. Higher frequencies produce better resolution, but penetrate less deeply. Lower frequencies travel further, but produce less detailed images. Understanding wave behavior helps clinicians choose appropriate settings for imaging the heart, abdomen, or developing fetus. The Doppler effect, another wave principle, allows measurement of blood flow velocity. When sound waves reflect off moving blood cells, their frequency shifts slightly. Analyzing this shift enables assessment of valve function and vascular obstruction. Without wave physics, non-invasive imaging of soft tissues would be impossible. Reflection depends on acoustic impedance mismatch. Large differences, like soft tissue to air, cause strong reflection and poor transmission. Hence, gel eliminates air gaps. Attenuation via absorption and scattering creates artifacts. Shadowing suggests calcification. Posterior enhancement suggests fluid, aiding differential diagnosis. Phased arrays steer and focus beams for frame rate and resolution trade-offs. Cardiac imaging favors high frame rates to capture rapid motion. Doppler sampling is limited by the Nyquist frequency, velocities exceeding it alias, prompting higher pulse repetition frequency or lower baseline settings. Thermal and mechanical indices guide safe exposure. Diagnostic ultrasound operates with wide safety margins when prudent scanning and minimal dwell times are used. Elastography estimates tissue stiffness, while contrast agents enhance microvascular flow, expanding ultrasound's diagnostic reach. Finally, beyond motion, flow, and waves, the body is also governed by energy exchange. And now, thermodynamics. Here we consider heat, energy, and metabolism. Thermodynamics is the study of energy, heat, and work. The human body is a thermodynamic system. We convert chemical energy from food into mechanical work and heat. Not all energy becomes useful work. Much is released as heat. Maintaining a stable internal temperature is essential for enzyme function and cellular stability. Heat transfer occurs by conduction, convection, radiation, and evaporation. Clinicians apply these principles when managing hypothermia or fever. For example, in surgery, careful temperature regulation prevents complications. In neonatology, premature infants require controlled thermal environments because their heat regulation mechanisms are immature. Metabolism itself reflects thermodynamic laws. Energy cannot be created or destroyed, only transformed. The body must continuously balance energy intake and expenditure to maintain physiological stability. Understanding thermodynamics helps clinicians interpret metabolic disorders, manage critical care environments, and maintain homeostasis. Additional. Clinically, the first law tracks internal energy via heat gain and work done, while the second law frames entropy and heat flow direction, vital for understanding inefficiencies in biological energy conversion. Additional, indirect calorimetry estimates resting energy expenditure from oxygen consumption and carbon dioxide production, guiding nutrition and critical care. Additional, fever reflects an elevated hypothalamic set point. Antipyretics reduce prostaglandin E2 to lower the set point, enhancing heat loss through vasodilation and sweating. Additional, rewarming strategies escalate from passive to active external and internal techniques. Rate control prevents afterdrop and arrhythmias. Additional, premature infants have high surface area to mass ratios and thin skin, increasing evaporative loss. Humidification and skin-to-skin care mitigate instability. Additional, metabolic flexibility, switching fuel sources by demand and hormones, declines in critical illness and insulin resistance, informing glucose targets and nutrition plans. Closing summary mechanics explains how the body moves and withstands force. Fluid dynamics describes how blood and air sustain life. Wave physics enables imaging through ultrasound. Thermodynamics governs energy balance and temperature regulation. Together, these principles reveal that medicine is deeply rooted in physical law. Every clinical measurement, pressure, flow, force, temperature, reflects physics in action. In Part 2, we will extend this foundation further into electricity, light, radiation, and modern imaging technologies, where physics not only explains the body, but allows us to see within it in extraordinary detail. Please stay tuned to watch upcoming videos on the new series on applications of physics to medical sciences. Like and share the video, follow and subscribe to this channel for more useful content.